This is Ed Salzberg. I'm the Managing Director of the Security and Sustainability Forum. We're an educational membership organization that convenes global experts in online free webinars to address issues that affect the environment and the security of nations and society as a whole. You can get free access to all of our recorded webinars by signing up for free membership at our website, securityandsustainabilityforum.org. Over the next several minutes, I'll be interviewing the moderator of the fourth in our Adaptation and Security series on public health and climate change. The moderator is Jonathan Paz, who's a professor at the University of Wisconsin and the director of the Global Health Institute, as well as the founding president of the International Association for Ecology and Health. He's really one of the global leaders in this area. Jonathan, the title of the webinar, Climate Change and Health, is Risks, Preparedness, and Transformation. Why did you pick that topic?
Well, I view climate change as one of our most challenging public health issues we face today. We're used to dealing with single-agent toxins or microbial infectious diseases, but climate change really cuts across many exposure pathways, be it from direct heat waves and air pollution to waterborne and insect-borne diseases, infectious diseases, and especially potential global malnutrition if climate affects crop yields. So I view this as really a very complex, challenging environmental public health issue that can pretty much affect the entire globe.
So in reality, there really is a health impact from all of the various climate change disruptions. You picked quite an eminent panel for the session. Could you explain how you chose them and what they're going to be addressing?
I think we've got a group of speakers for this panel, top people in the field of climate change and health. Dr. Alistair Woodward is the head of the School of Population Health at the University of Auckland in New Zealand. And he is also convening lead author of the health chapter of the current United Nations Intergovernmental Panel on Climate Change, or IPCC. This is the most authoritative body of scientists working on assessing climate change science and impacts. And as convening lead author for the health chapter, he has the most up-to-date knowledge of the latest studies cutting across all aspects of health and climate change. So I think to have him on board is fabulous. Dr. Ann Lyon is the project director for APP's USAID flagship Health Systems Strengthening Project, Health Systems 2020. She's got incredible global health experience working on global AIDS for USAID, and also formerly with the Program on Appropriate Technology and Health, or PATH. And so she's going to be speaking on how healthcare systems need to be resilient and flexible. Today, as climate scientists are telling us climate is changing, climate is no longer stable, and we need to think of climate as now variable. And with that recognition, our health systems also need to be flexible and be able to adapt to changing climates and other environments. So I think her perspective on future healthcare systems and being more medically prepared for climate change will add some excellent discussion points. Sir Andrew Haynes is a professor and past director of the London School of Hygiene and Tropical Medicine. He was knighted actually in England for his leadership in preventive medicine and primary care. Most recently, he pioneered a series of studies to evaluate the potential health benefits from mitigating greenhouse gases. We call these health co-benefits. To reduce greenhouse gases, like from burning fossil fuels, especially coal and oil, we need to reduce greenhouse gases to reduce climate change, temperature elevations, but there can be some immediate health benefits when we think about getting away from our fossil fuel-based economy. Today, local urban air pollution still kills almost 1 million people prematurely every year. Also, cities are designed for the automobile, and many of our populations are not getting adequate exercise. So some of these fossil fuel dependencies are very unhealthy. So he led a group of studies that looked both at energy production and transportation as well as building structures to look at how green technology could provide some immediate health co-benefits. Finally, Dr. Diarmaid Campbell-Landrum from the World Health Organization is an epidemiologist and is the primary person in charge of climate change health research at the World Health Organization. And he will be talking about the WHO perspective on climate change and introduce the new program called Health in a Green Economy, also leveraging off of the realization that greener technology, more livable cities that are walkable or bikeable, these types of innovations can have tremendous health benefits. And so along with Andrew Haynes, I think we'll have very good representation of some transformational benefits that we have at hand if we are to tackle climate change.
Jonathan, what I find most impressive about the webinar and the panel members is that you'll be not only addressing the problems, the issues, but also be delving into some real practical healthcare, public health solutions.
Oh, absolutely. And I think that it's wrong to view climate change in isolation, and we need to realize that everything is interdependent. Our energy systems, our agricultural systems, and our climate systems. And if we think about addressing all of them at the same time, or at least trying to get the right experts around the table to grapple with these interrelated issues, that there are some incredible synergies and potential multiple benefits if we try to tackle these problems.
The webinar discussions will be appropriate for the general public, for students, but also for scientists in the public health field and in related fields such as emergency response and management, energy efficiency, hazardous waste, toxic control, environmental policy, both national and global.
You're having the world leaders in health and climate change participating as panelists from the World Health Organization, the head of the health chapter of the Intergovernmental Panel on Climate Change, and the director of the London School of Hygiene. You've got key people that will be delivering important policy-relevant information on climate change and health, both the risks and potential opportunities from transformational change as we try to green our economy.
This is clearly going to be one of the best webinars that we've had, and we've had some great ones, I have to say. Please go to the website, www.securityandsustainabilityforum.org, to sign up. If you only come to one of our webinars, I think this is the one not to miss. Thank you very much, Jonathan, and I look forward to seeing you on January 26th.